This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to tell if you have hip arthritis. If you like this video, we put out new content weekly, so please like and subscribe. So hip arthritis, how to tell if you have hip arthritis. First of all, you'll probably be on the older side. Can you have a younger person with hip arthritis? Yes, but that usually only happens if you have some sort of like congenital issue, like let's say your socket never formed right, called hip dysplasia, or let's say you had a bad accident. I mean like really bad accident where like you broke a bunch of bones in your hip. That can cause early hip arthritis. Other than that, most of the time it's people in the later decades of their life. And so when you do have hip arthritis, you'll have pain right in your groin. Not really on the side of the hip. That's more hip bursitis. Sometimes hip arthritis can present as pain on the outside of the hip, but for the most part, by and large, it's in the groin. You'll find pain when you kind of move it through motion. And most of the people notice this actually, funny enough, when they put on their socks. So if you wake up and your hip is stiff and it kind of hurts in your groin when you walk around and you put on your socks and it's excruciating and you're older and you never did anything to your hip that you know about and your family members may have hip arthritis, then you probably will have hip arthritis. The definitive way to tell is just to get an x-ray. You don't need a CT scan or an MRI. You just get an x-ray of the whole pelvis and then of that specific hip, and that'll tell you pretty quickly whether there's arthritis or not. That's the best way to tell. But if you're just at home and wondering, if you have pain you're growing, gets worse in the morning, kind of gets better the day goes on, and you can't put on your socks, you may very well have hip arthritis. So I hope I was able to answer your questions about how to tell if you have hip arthritis. If there's any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but I can't give you specific medical advice about your specific condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.